The John D. Thompson Award for Excellence in the Delivery of Healthcare Through the Use of Data has been presented to a Connecticut hospital for the past 19 years. This prestigious award recognizes a hospital for excellence and improvement in patient care through the use of data. It honors Yale professor John D. Thompson for his distinguished contributions as an educator and researcher in health administration. This year, the review of blinded entries from many Connecticut hospitals by the independent panel of judges resulted in a tie. There are two John D. Thompson Award winners for 2012. They are Greenwich Hospital and St. Vincent's Medical Center. Greenwich Hospital is being presented with the 2012 John D. Thompson Award for its comprehensive multimodal analgesic regimen for joint replacement surgery.
Multimodal regimen at Greenwich Hospital is a new, comprehensive, evidence-based regimen that we designed to improve pain control for patients after they have joint replacement surgery. We realized the importance to treat pain before it even started. They'd get medications by mouth before they go to sleep, different medications in the operating room, and continuously get multiple medications from different classes of pain medications after surgery.
Mark Krostowski and I got together, and Mark really formulated the multimodal plan and got the medical staff on board. I went around and in-serviced all the nurses as to the new protocols.
We also took the extra steps to monitor how patients feel after the surgery. On a monthly basis, we collected data from their medical record, from a nationally benchmarked patient satisfaction survey, and we used that data to refine the protocol, to improve the protocol, and to provide better care for patients.
Good morning.
Hi, good morning.
When I arrived at the hospital for my surgery, I was very efficiently taken to surgery, and the next thing I knew, I had a new hip. When I woke up, I was not really in much pain. When the day after surgery arrived and it came time to throw me out of bed, the fact that it really wasn't nearly as painful as I thought was very encouraging.
The results of the protocol have been really dramatic. Once fully implemented, patients on average required 40% less opioid pain medications. We noticed a decrease in opioid-related side effects. Nausea, vomiting decreased by 50%. Pruritus or itchiness decreased by 97%. And pain control was easier achieved.
The pain medication has really allowed our patients to become much more actively involved with their physical therapy and their rehab.
The PT here was very aggressive, but in a very nice way. I had a very positive attitude. I was not going to not walk as soon as I could, and they were being very careful about the pain. So altogether, it seemed to work well to get me up and going as quickly as I could. It was about 5 weeks ago, and that pain in that part of my leg disappeared. My overall quality of life is already greatly improved.
After collecting data for 18 months, Greenwich Hospital now ranks in the top 99th percentile for pain control after joint replacement surgery.
The difference between what we're seeing now in our patient population regarding both pain management and side effects is vastly improved from what it used to be. I've been here long enough so that I've seen patients who are now returning for another joint replacement or a revision of the same joint, and they are far more satisfied now with greater pain relief and much fewer side effects than they had in the past.
St. Vincent's Medical Center is being presented with the 2012 John D. Thompson Award for its implementation of high reliability behaviors that are resulting in significant reductions of preventable harm to patients and employees.
What we're doing at St. Vincent's is working on changing the culture to make it a safer place for our patients and our associates. Before we started on this cultural change, we did an analysis of serious safety events, and that became our baseline.
One of the first steps after that was really to educate everyone, including our physicians, including our board, and then to educate 2,400 staff members to do extensive education in the characteristics of high reliability organizations and in using safety tools and behaviors. Some of the tools include validating and verifying, something called STAR, Stop, Think, Act, Review, and really the concept of 200% accountability, that every single person in this organization is responsible for safety.
The best part of this is our daily safety huddles. All of our departments, including finance, and all the clinical departments have a huddle every morning to talk about what concerns have they had over the past 24 hours that could affect a patient or a colleague.
Every morning at hospital-wide huddle, we talk about good catches and we present staff members with a safety pin. Safety is the key to trust.
I'd like to give you our pin that shows that you had a good catch. Yay!
We like to do a lot of storytelling because that's a way that we can prevent errors in the future and to recognize those good catches. Safety first is on every agenda for every meeting in the hospital. It's also a way to, of course, highlight that safety is the most important thing at St. Vincent's Medical Center. The safety coaches are a multidisciplinary team. We have clinical members, we have non-clinical members. A key role of the safety coaches is literally to do peer coaching and peer checking and to teach others how to speak up for safety concerns.
We have decreased our serious safety events by almost 60%. For our associates, we also had a very focused initiative.
Since we've used high reliability as a platform for employee safety, we've reduced our preventable harm to our employees by over 40% in the past 2 years. So that's pretty significant as well.
We've been successful in achieving a huge culture change. I think the staff are truly engaged, they're truly concerned, they truly feel a sense of ownership. And that's different than it was a few years ago.
When you actually know that patients are leaving better than they came and they're not harmed, that's why we get out of bed every day and come to work in a hospital, to make a difference in people's lives, and to be able to affect that through a cultural and behavioral change. Very powerful, very rewarding.